I recently had someone reach out looking for advocate help for a family member that they believed was in the hospital and not receiving their normal home medications. In this instance, it was mental health medications, so that further exacerbated the situation. I frequently hear from people who feel like they don't know what next steps are and are unsure of what their plan of care is. I had a client once who was told by the hospital that I couldn't be there with them, that they do not work with advocates. That hospital was also the subject of a national news broadcast on just how horrible they are, so there's that. Finally, frequently I hear from people who believe their loved one is being discharged too soon or home where it's not safe. Our next series of videos is going to look at your rights during and after a hospital stay. Knowing your rights and understanding your options can make a huge difference. We're going to start today with medications. Medication errors are a significant cause of adverse effects at hospitals. In fact, an estimated 400,000 hospitalized patients experience some form of preventable medication-related harm each year. Not just errors, but harm. So what are your medication rights? Well, let's start. Home medications. Upon discharge, they can be very difficult. You have the right to request your loved one's home medication list be reconciled with the hospital orders immediately. This is also why it's so important to know exactly what your loved one is taking. I'm going to plug Primary Record again. It's a health app available to anyone. All our clients have access to the unlimited version. I know exactly what each of my clients are taking, and so do their families if they have access to their record. You need to know what your loved one is taking, how much they're taking, and when they're taking it. Hospitals, however, are not required to continue giving home medications. They may have a safety concern or they may not have the exact medication your loved one is taking at home. They do have to provide safe care, but they do not have to give exact home medications. If there's a discrepancy between what your loved one typically takes at home and what they're receiving at the hospital, have a discussion to determine hospital reasons and advocate for safe care. Anyone in healthcare knows the 5 rights of medication administration: right patient, right drug, right dose, right route, and right time. If you have any questions, never hesitate to ask. You have the right to understand what you are taking, why you are taking it, and any possible side effects or adverse reactions. And you have the right to refuse medications if you have a valid concern. At discharge, and medications at discharge can be a doozy too. You have the right to know exactly what you are being discharged home on: the name, the purpose, how much, how often, how to take it, and again, any potential side effects or adverse reactions. You have the right to reconcile what you are being discharged home on with what you were taking before the hospitalization, and to make sure any changes are intentional and appropriate. Many hospitals now have meds to bed, so you can leave with the medications you need. Which reminds me, you need to know when your last dose was received and when you should receive the next dose. This is often found in your discharge paperwork, but make sure you understand before you leave. Your medication rights while you're in the hospital are very clear. Understanding your rights and being your best advocate for yourself or your loved one is vital. If you want to learn more about healthcare and insurance, please follow along. Have a question, drop it below, and we'll do our best to answer it or at least point you in the right direction.